Hello, it's Michael Brown from Cram Osteopaths in Glasgow, and today I'd like to share this patient case with you. This patient came to see us with a long history of low back pain spanning 40 years, with the first episode happening in their mid-20s, likely from a disc issue that resulted in back pain and sciatica. This patient is now in their 70s and never really felt their back was ever the same, always felt they were leaning to one side, would regularly get episodes of low back pain and leg pain, and the symptoms were progressively getting worse, and it was interfering with absolutely everything in their life. Everything had to be thought about. Where they would go to the shops, where was the nearest bench, what restaurant they could go to sit down in. It just consumed every activity. This patient had already had an MRI scan that revealed degenerative changes to the L3, 4 and 5 segments of their spine, with a scoliotic pattern through their lumbar spine. Treatment thus far for the patient had been failed nerve root injections, failed courses of physiotherapy and exercise-based rehabilitation, and the patient really was struggling to find a solution. They had a lot of life in them, and they wanted to be able to do all the things that they felt they could do in their mind, but their body was holding them back. Now, when a patient arrives with a long history of back pain and acute symptoms at the time, we need to set expectations in line with reality. People walk in and they want to, what would you like to achieve here? I just want to be pain-free. Now, that isn't always possible, especially with a large amount of degenerative change and a long history of symptoms. So we spent a lot of time with the patient working on treatment goals, and what would be the first goal? What really would make them happy with the back pain that they have? So the goal was put forward that they wanted to be able to stand and greet family members who were arriving, who had been away for a long time. Now, this was very, very significant. That was a very important moment for this patient, and we decided, okay, that is goal number one. It's happening in a couple of months' time, and we think that's going to be achievable. The patient started the IDD therapy the very next week, and with a frequency at 3 visits per week. As you can see from the improvement in the pain scores in the patient, that after 17 visits of IDD therapy, this patient went from an 8 out of 10 on the pain scale with severe pain and disability in everyday activities to a 0. This is something that the patient hasn't not been in this place at a 0 since before the first episode of back pain in their 20s. This was an absolutely brilliant result with this patient. It was far beyond my expectations in a case like this, but it was unbelievable. It was really great to see that the emotion from this patient coming back, and the things that have become just everyday things that become very difficult, to be able to, the patient was coming in saying they were able to walk around the shops without having to sit down. I mean, something that we all take for granted, but for this patient it was just too difficult, the pain's too severe. And so these small milestones, and as the treatment progressed, I knew that we've got this. You're going to be able to hit that point where you're going to hit your goal of being able to stand, greet family, and give them a hug without worrying about having to sit down and with back pain. This patient is doing very well and has continued to remain at a 0, and I'm absolutely delighted for them, and it was a real success. Now at the practice, in our West End practice, as you can see, we have 2 IDD treatment units here, and we're seeing a lot of patients with chronic low back pain that are looking for that haven't responded to other treatment options and looking for alternatives. So we'd be delighted if you know anyone that you think this therapy may be suitable for. We'd be delighted for you to get in touch, and we look forward to hearing from you.